Hello out there and welcome to yet another edition of Public Conscience. This is the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMOG. PRIMOG is a civil society group with a mandate to promote good governance, accountability and participation in Nigeria. I am Adaobi Obiabumo with Chidozie Ogbonnaya.
Welcome to the program.
On Public Conscience on Radio, we seek to evolve a corruption-free society through the amplification of corruption stories reported by our partner media organizations and drawing government and citizens' attention for democratic actions against it. This program is supported by the MacArthur Foundation. And on today's program, we'll continue to look at reports exposing government, ministries, departments, and agencies of breaching procurement processes in the fight against COVID-19.
On this program last week, we examined an investigation by DataFight which indicted 5 government MDAs in the award of COVID-19 emergency procurement worth 451.18 million naira to unverifiable contractors, while that of Civic Hive exposed how the Federal Ministry of Health awarded 15 out of 29 COVID-19 contracts worth 444.8228 million naira to a single company.
Resource persons and Nigerians who called into the program were outraged at Civic Hive's disclosure that the Ministry of Health bought face masks on the average of 10,000 naira each.
On today's program, similar investigation by International Center for Investigative Reporting, ICIR, shows that the National Primary Healthcare Development Agency, NPHCDA, inflated prices of infrared thermometers by more than 200%.
Additionally, it was also revealed that the Nigerian Center for Disease Control, NCDC, spent the sum of 202 million naira on 6 contracts from the COVID-19 Intervention Fund without evidence of procurement plans. To help us better understand these anomalies by government MDAs, we have in the studio a reporter with the ICIR, Amos Abba. Welcome to the program.
Thank you for having me.
We also have Adib Raji. He doubles as the managing partner, Global IT Africa Limited, and convener of Stay Away Corruption Campaign, SACC. Welcome to the program.
Yes, thank you.
We'll start by speaking with Amos Abba from ICIR. Would like you to give us an overview of your report and why ICIR took interest in it.
That report, I think it was during the COVID-19 lockdown, and it was an in-house training via Zoom, and we're examining, I think we're doing something related to data training. And so we're looking for specific data to use in the training. So someone suggested Nukupo, a Nigeria open contracting portal. So we just looked into it and so this is a good source for stories. And I started checking it up while the training was actually going on. And I looked up for thermometers and I noticed it was assigned to the NPHCDA to get thermometers as an emergency project. So while I checked it up, so I wanted to get details into how did it go, because it was there actually. So I was examining it and I was like, let me compare prices. If you're going to supply 2,615 thermometers at about 226 million. So let me see how much is the average price in, let me compare it, the unit price, comparing it with prevailing market prices. And actually check, it was outrageous, very outrageous. Where for the contract quoted by the companies involved, 4 companies, really showed that the price for a single unit was about between 80 to 83,000 naira, 84,000 naira, and while in the market you could get it for 20,000 naira, between 20 to.
So there's a difference of
a
over
huge
60,000
difference,
naira.
a very huge difference.
Thermometer.
Yes. and that was what actually piqued my interest, and I had to do a report on it.
Amos, paint the picture very well. In which market? Nigerian market or international?
Actually,
tell us the markets you got involved.
I checked with retail stores online, Jumia and Amazon, to see, okay, let's see how much it's on that market, because it's a market that's accessible worldwide, and the price was still the same within that range. You could get for 20 to 30,000 naira. So, and when I saw that, I had to put that in the report. But I reached out to MPHCDA to actually get their thoughts about it. So I tried reaching out to the spokesperson. I couldn't get him, so I had to drop a letter, putting my questions in the letter. And
did they respond?
Of course they did.
What was their response?
And their response was, because in my report I highlighted two things that contract actually did. Apart from the inflation of the prices of the thermometers, there was contract splitting. And also, because I checked out the 4 companies involved in that project, and I noticed that one company was not registered by CAC. Because on the CAC database, just an open source database where you can put in the names of Nigerian companies, and it brings out their date of registration with the CAC and when the company started. So 3 companies checked out, 1 didn't. And also,
so if I want to check for such information, I could just go to CAC website.
Yes, they have a database. Yes.
Okay,
and just search, do a company search. Put the details. Yeah, so I did that, and 1 checked out. 1 didn't check out. The 3 checked out. So I also send observation to the NPHCD. How come is it that we were able to issue contracts to a company that was not legally registered, which is a breach of the 2007 Public Procurement Act? There was no response till date to that question. And also, so I highlighted...
You said you sent a letter to them earlier.
Yeah.
Did they respond to that?
Yes, they did. They gave me reasons why there was contract splitting. Contract splitting is when a company bids for a contract, and for a single item, for instance, let me just use an instance in the story. Asmu Pharmaceuticals, one of the companies involved in that project, and they bidded to supply 605 thermometers, and they also did another bid to supply, I can't get the exact figure, of another certain number of thermometers also. So, and I was wondering, how come will a company bid twice and get the contract twice? So the NPHCDA actually said the companies that got 2 contracts for supplying the same item, that they had it in their warehouse. They had thermometers in their warehouse. So when they bidded, they noticed that the number that was quoted, it was not enough. So they had to import more thermometers. And that's why they gave them 2 contracts. Yes, that was the explanation they gave to me via the letter, the response to the letter I sent.
Okay, Amos, let's move on. Because if I get you right, the country was being ripped off of over 50,000 naira in that investigation.
Exactly.
Right. So, but is this the only shocking revelation you got from your investigation? What also shocked you or struck you during the investigation?
Corruption issues is not really, I can't say it's shocking anymore to me.
Okay.
Personally.
Is there any other big issue that you found out?
Apart from the breach of the Public Procurement Act, contract splitting, there was no much. I think that was the only thing that stood out for me. That was the only thing.
Let's get to Adibaraji. You've listened to Amos of how some of these MDAs inflated the prices of thermometer. How would you react to this investigation?
Yes, thank you. It's very interesting that we are getting this kind of...
Is it strange to you?
Not strange, but it's becoming open. due to technology and due to the openness of the system. That is what we have advocated for a long time, for us to have a system where anybody can access, where you can actually see what is happening and then how it's happened and then what is the effect of what has happened. And you can see that is a part of the benefit of open contracting, you know. The civil monitoring is becoming high. You understand? We are here today to analyze it. Before, it's very hard to get this kind of a platform, to even get this information available there. Yeah. And having this kind of system working that way, it means that there's a light at the end of the tunnel.
Okay, that's you are optimistic,
Yeah.
and we are all optimistic. But before I get to my question, the open contracting,
Yeah.
do you have an issue with the compliance rate?
Okay.
That is one. Then you go ahead to tell me your experience in public procurement process in Nigeria, and share with us what a red flag means in procurement and why transparency and integrity in public procurement continue to be a challenge in Nigeria.
One thing with open contracting is that what it has is for us, for everyone to see how the stages are transparent. You know, it involves accountability, transparency, value for money. You understand? These are the things that what it actually flag out corruption in any system. Open contracting system is, you know, is just like providing an open data where anybody can actually access. You understand? Now, Nigeria is keying into that platform, which is very, very, very good for us. Compliance is very huge, huge problem that every country and then some organization actually have an issue with. That is why if you look at procurement strategies, you understand, you see, first of all, you see policy. How is the policy, how people are complying to this policy. Now we are talking about COVID-19 specifically. You know, COVID-19 is, which was tagged as a pandemic, and then, you know, came up with, you know, so many emergencies, you understand, and then when you procurement in an emergency situation, flag corruption risk. You understand? The corruption risk in an emergency situation is very high because it's not.
Why
all,
is that so?
Okay, because it's not all the stages of procurement process can be achieved within short period that you need to tackle that emergency. For example, there is an avenue for negotiation. You understand? And then you are in a situation where you need to do something like yesterday. Therefore, the issue of negotiation, the time frame for negotiation will be so high. Now, again, there is what you call budgeting. You know, they normally do their budgeting before they will now start looking for suppliers, right? Now, the budgeting aspect is not here because it's an emergency. You understand? Maybe they have a previous budget in that particular items, but because of emergency now, if it's 30 before, they have to increase it, let's say, to 30.
But is that enough reason why an organization would inflate the price of a particular item?
My analysis now is not going to the corrupt aspect. I'm looking at what this is the key terms that actually instigate corruption in procurement process during an emergency. Now, having a system in place that actually flag out the accountability and the transparency is now the angle we are now. Do you understand? If you have that conscience that whatever you are doing now is you are going to account for it, do you understand? You will not bring in corruption. You will not involve in corruption. And now that what we are now at this stage of analyzing it, we can now see what the transparency in the form, in the transparency in the system is now showing. That is where you can see, even I checked today, this morning, from Nigeria Open Contracting System Portal, and you could see something that will just strike your mind. You don't even need to have a kind of experience in data analysis, you understand, to flag out some of the item where you see that a particular supplier called Mr. A actually supply the same item with Mr. B, and then the prices are different. Therefore, where did they get the source from? You understand? You begin to ask yourself.
It gives room for probity.
Yes.
You need to probe more to it.
Yes, more to it. Those are the things that was actually, the system is actually bringing it. And then, when it comes to procurement strategy, when you view it into policy, you view it into data. This is the data we are analyzing now. You view into coordination by having e-procurement system. You understand? We give coordination of all this, or viewing it into supplier insight. You understand? The supplier insight is that you have several suppliers. Are they into the portal? You understand? He mentioned a supplier that you could trace to CAC, and then you cannot see their information on CAC. Now, how do you give a contract to them? That is a red flag to me.
I will get back to you, but let me talk to Amos. I will read what is in the report. According to information available on the website of the World Health Organization, WHO, the NPHCDA was expected to provide Nigerian healthcare workers with personal protective equipment and improve the dissemination of health information and measures to protect oneself from COVID-19.
Yes.
Did you see that play out?
I'm yet to actually see that play out. I did a couple of stories on not this particular one, on primary healthcare center after that period, and I've been to I can say in several what's it called? Yes, within Abuja, and so far I didn't see that. Most places you don't see. Most primary healthcare centers don't have thermometers. Yeah, they don't.
Aside from thermometers,
yes,
the report says personal protective equipment.
Exactly, that's what I'm saying. I'm getting there. Is that some of those primary healthcare centers I visited, you don't see those materials. Some of them don't even use, because I visited rural areas. There's somewhere in Abaji called Manderegi. It's a village. The person I was speaking to, the person in charge of the primary health center there, didn't even have PPEs at all. The person wasn't using any. So from my visits around primary healthcare centers, I can't say effectively that thing has been realized, that the objective of what the NPHCDA should do was actually realized.
If you are to rate it in percentage,
yes,
where will you put it?
I'll give it a 30.
And that's
below
very,
average.
very low.
Exactly.
Okay, Amos.
Yes.
Okay, let's look at Adiba.
Yeah.
You're with me? Okay. What are the dangers of corruption reports caused by shoddy procurement process and bad governance? Because I understand that your organization are also championing the war against corruption. So let's get your take on this.
Thank you for that. The danger is very, very high. The danger, let's look at it from this perspective. You are to procure an item, a life-saving item, and then this life-saving item are supposed to be delivered to a particular hospital or a particular health center, and then you have inflated the price by 200% according to Mr. Amos. at that base, you have killed the economy, right? And then the value for money is action. You understand? The danger is something that we cannot just use one word to describe. You understand? Because he mentioned something by to be supplied to, and then you can't see a trace. That's it. One aspect is inflation. The other aspect is that what is that item even delivered? Was it even procured? You understand? That is another angle in the procurement this thing. What is the sign off at the end of the day? You know, if looking at the open portal, you understand, it's supposed to be something that is transparent from the first day to the last day, because you are supposed to provide the data, the information, the document at all stages. You understand? To the final stage. Now, looking at it in the form of, in as far as you can contact Mr. A, you should be able to also contact Mr. B. And then these are items that is not just an item that will not be using, the organization has not been procuring. It's an item that you know. But the only question in an emergency is that what the number you need, the timeline is now more high. That is just the difference.
So what is the resultant effect of this?
Aside from this, from what Amos said, that when he visited, those items were not on ground. We're not even looking at the danger of this on the health workers.
Yeah.
We know what COVID-19 is all about.
Yeah.
So many of us were scared. So many of us were inside our houses. But these health workers were out there, working diligently, without this personal protective equipment. Nobody's talking about the dangers on that.
That was the second angle. You understand? You know, first is that what the on the economy, the amount has been inflated, which is supposed to be used for other things. The second point is that what is that item there? The people that are supposed to use the item, they are already in danger, because what, you know, there is one thing that doctors normally say, that what they cannot deny you of service. They must, you know, they must give you that service. That is the mandate. You understand? And then, in as far as they want to save your life, their own life is also at stake. You understand? And you now see the danger is so high. You understand? It's so high. But looking at it in a procurement and then corruption angle, you understand? You see that what it still boils down to the integrity, the transparency in the system, and then everyone's knowing that what you have to be accountable to whatever you do. You understand? As a civil servant, as any public officer, you should know that whatever you are doing has a ripple effect. You understand? Out there, and that is why we are here now. You know, looking at the different angle to this report. The danger is not something we can actually quantify. You understand?
Yes, you are saying the danger is massive. Would that be the word you are looking for?
The danger is catastrophe.
Okay.
You understand?
Okay.
Let's get the listeners to contribute to the conversation. We've been speaking with Amos Abba of International Center for Investigative Reporting, ICIR, and Adiba Raji, who is the convener of Stay Away Corruption Campaign, SACC.
Once again, listener, we want to urge you to follow us on our social media platforms at Official Primorg. And Primorg is spelled PRIMORG.
The phone number to send your message is 0902-265-6167. That is 0902-265-6167. We'd encourage you to send your messages, and we'll take them while the program is on, or you could send a text message to 265-6167. Do you think the billions of naira spent by the federal government against COVID-19 was well utilized? And did you receive face masks, sanitizers, palliatives from the government since COVID-19 this year? Amos, I'll get back to you now.
I will wait for the calls.
In the course of your investigation,
Yes.
you got your data from the Nokopo platform, that is nokopo.bpp.gov.ng.
Exactly.
Did you at any point during the investigation get response from Bureau of Public Procurement?
No, I didn't. It was very obvious because it's an open source. The data I got was an open source data. It wasn't hidden, it was in plain sight. And the breach on public procurement was also very plain. I think my only concern was why the agency will actually breach the BPP regulations. That was my major concern. So I didn't actually reach out to the BPP in the course of the report because the breach was obvious: contract splitting, inflation, and also registering a non-accredited firm by the CAC. So those are the three things I highlighted before I started the report. Those are breaches that were known. So I didn't bother reaching out to them.
Is this happened in the two reports we are looking at? Contract splitting, registering contractors that are not on, you understand? So on the two reports
no, it's the single report on the thermometer.
Okay, on the thermometer.
Yes,
all
yes,
right.
yes.
Just to
yes.
get clarification on that.
The single report on the thermometer.
Did you get across to NCDC?
No, I didn't get across.
Okay.
I didn't get across to NCDC.
Okay. All right. Let's get to Adiba. Adiba, you've been following this corruption report. Yeah. But like our guest said last week, our guest told us that there is no commensurate value for money spent by the federal government, in trying to counter this COVID-19 pandemic due to flawed procurement processes. Do you share the same view?
To some extent, corruption risks in procurement are even more than pronounced when it comes to emergency. You understand? When you're looking at the corruption risk, you understand, in a normal procurement system during normal budgeting or situation, and then comparing it to an emergency situation is a two different thing. We might have heard of what happened in the US and in the UK. You understand? In the US, where contracts have been awarded to companies that is not known, it's not also registered, over so much billions of dollars. In the UK, the same thing also happened.
Hello.
Hello.
Your name and where you're calling from?
My name is Ohi Unwingwe. I'm calling in from Busetsu.
Let's hear you, please.
I've listened a bit to what you're all discussing, and amazing job. But I am wondering, I really do not know if the person who fished out this corruption, let's call him the whistleblower right now, is he working for a corporate organization, an NGO or something? And if he is, or he's an individual who is interested in just blowing the whistle on all of these corruptions, what procedure do they have in advancing to make sure that these people or parties, the corporate bodies involved and the individuals underneath those bodies and the administering government institution to see that they are petitioned to the appropriate quarters, the ICPC, the EFCC, or the Inspector General of Police, so that these people can be punished. It's not enough to know that crimes have occurred. Crimes should be prosecuted. So what's the next stage? What's going to happen? Are we just going to sit here and talk about it? Or are we going to get it to the next level and see that these people get punished for violating rules and laws and committing these kinds of flagrant abuse of offices and blatant corruption, thieving actually? That's my question and observation. Thank you.
Thank you so much. I want to emphasize that this report was done by International Center for Investigative Reporting, ICIR. ICIR is a non-governmental organization.
And as for the report, you will tell us more. He just threw a question. Let me not answer for you. You're here.
Yeah. I'm a journalist, and the International Center for Investigative Reporting is also apart from it being an NGO, it's also a media.
Just hang on.
Just hang on there, please. Hello.
Hello.
Your name and where you're calling from?
My name is Queen. I'm calling from Abuja.
Let's hear you, Queen. I'm happy that a lady called in. Let's hear you.
Yes, I've been listening to the journalists in your studio there. And I'm so happy that at least we still have some people that are still doing some investigative journalism. But yeah, one thing I want to ask is, after this report, and after getting all these stats and figures, are they going to push their findings to ICPC or EFCC so that those people can also investigate and then bring the people that are doing all these things, all these corruption activities to books? To radio and discuss it, at the end, these people will not be questioned. The corruption is too much. Just like he said, during that lockdown, that total lockdown, a lot of people were suffering. And these people were making announcements every day that they are sharing face masks, they are doing this, they are doing, and nobody is getting all these things.
Thank you so much, Queen. The same question like the earlier caller. If EFCC, ICPC, and the IG, do we have to petition them?
Do you even contact them, Amos?
Yeah, you see, that's
but
not.
Ideally, when a report like this is out, do you need to write again to
Exactly.
the EFCC or the ICPC to say, "Oh, we've done this investigation"? It's out there.
It's out there.
It's in open sight, so it's left. We are not the police. It's left for them to actually do their jobs. That's why they collect taxpayers' money. We pay them at the end of every month, and that's their job. So we took the extra mile, went out and brought this thing that was hidden into the open. So it's left for the enforcement agencies to actually take action to bring the people to book.
But let's assume that ICPC, EFCC, they are not aware, they did not see it.
Yes.
You have plans of writing a petition to them?
No, because being a journalist, I think there are several facets to actually how to prosecute wrongdoings. First, I'm a journalist. The Fourth Estate of the realm, its function is not, it's limited. I think what is the office of the citizen that can actually petition the agency or petition the people involved, because as a concerned Nigerian, the bungling of that contract affects everybody. My duty, and ethically, it's for me to bring out the problem, expose the wrongdoing, and it ends there. Then the rest.
You're urging the citizens to stand up, look at this report, and go after it, petition.
Yes, of course.
And for the benefit of the public, they can go to ICIR. These reports are on your website,
exactly,
right?
Exactly. They are there.
We have a message from, let me quickly get this, from Dale from Abuja, and he says, I think it's disheartening to think that as a nation we will be corrupt with healthcare, endangering the lives of our own health workers and patients. The most painful thing is that the perpetrators of these heinous crimes will go unpunished. I don't want to believe that they will go unpunished.
And I sense a bit of a weariness from the callers. But I want to say that it's more dangerous when we don't say anything, when we keep quiet, when some of these reports come out. I believe the government is listening and they will do something. I have to stay on the optimism side this time around.
Adiba, how would you react to it?
Like I said, the open contracting actually exposed the data, you understand, and it checkmates the stages if anything happened to be between as the stages flow, and we can see those elements now. You understand? We have started seeing before you get this information before is something that is not you have to dig to it. You understand?
But are you worried that
the aspect now is that what is available is available to now what the agencies that have the mandate, you understand, to do the right thing. You understand? Analyzing it here is just to bring their conscience to this. If you don't know there is something existing, the report is not something that is being cracked from somewhere. It's open there.
it's official?
It's official. And therefore, the EFCC, whatever, they don't need any petition, you understand, to do their work. You understand? Like I said.
So, are you worried about this deafening silence from our anti-graft agencies who are supposed to go after such anomalies in contracting?
I will not say I'm worried because I may not know what they are doing behind. You understand? They may be doing a lot behind, but the main thing is that whatever they are doing, they should also be transparent to the citizen to say, okay, we have said this. They have handling. You understand? They have their own website. They should also talk to us as we are saying this now. It should also be a question to them that okay, we have looked at this and then we are doing this, because you may call them now and they will tell you that they are doing something about it, but to what extent?
Are there ways that we can try these MDAs in court, or individuals or contractors in court?
Yeah, I think the major this thing here is that there is an avenue for civil monitoring, which we are doing, and then the civil society organization bringing this up, you understand, and then engaging government to do the right thing, and that is one step we are doing now. You understand? You got the report, and then you have to analyze the report. And other agencies that are supposed to do their own work are also out there to also put their own torchlight into it and see that these issues are brought to book. It's a gradual process, I believe, and then we're already on it. It's saddening that we do things like this when the tension is high, when we are looking to save life, and then people are just there to make money, you understand, and then it's a situation where we will find ourselves, and then we still believe that the right organization and the right people will take it from here.
Amos.
Yes.
Are there other ways we can try these people in court? Are there ways aside from the reports?
Yeah. There are ways. You see, but the problem is the justice system in Nigeria is actually slow. So, a case on corruption could be in court for a number of years, and it will actually weary the people involved, because these agencies have the financial muscle to be able to drag this case and make it drag it for years and make the people involved weary. So I think if there are more advocacy on issues on corruption, it might help in the long run, so that the people are put under pressure. You can, I understand civil society groups are actually working tooth and nail to expose. I feel that they are not doing enough. civil society organizations actually, because when reports like this come out, I think this thing should be in the public consciousness. These issues should not be, it should always be in the front burner on social media. It should be raised everywhere, just to raise the consciousness of the people. So when the people become aware, these agencies might also become afraid, because one thing about corruption is that they don't want corruption to stay hidden, and they don't want corruption to be in plain sight. Rather, they want it to always stay hidden. So I think with more advocacy on issues of corruption, they could go a long way in making anti-graft agencies actually prosecute these people.
And what should the citizens do?
Yeah, the citizens should become more interested in issues like this.
And Amos,
yes,
if you are deployed,
yes,
to advise the president or the government looking at corruption in MDS,
yes,
what will be your advice to the federal government in curbing COVID-19 spending? Yes, the spending must have come, and I don't think they're totally gone.
yes.
But what would be your advice?
Match words with action. It's not enough to hold a press conference and say you are fighting corruption. Be deliberate about it, be definite about it, and be serious. If you make mere words and you don't put action to those words, it will just be a jamboree that keeps coming, and every year we hear the same rhetorics. But match words with action.
We got a message from King Solomon, who is watching us on Facebook. Okay, he said, apart from exposing all these corrupt practices, are there ways of getting them tried in court?
And that was basically what we are talking about, just few minutes, getting them tried in court. We'll move to Adiba as we try to wrap things up.
Let's take this
Okay,
call.
we have a call.
Hello.
Hello?
Yes, good morning. Your name and where you're calling from?
Okay, this Abdul Wahab. I'm calling for Pape.
Let's hear you.
Okay. We are talking of the issue of corruption in this nation. We are forgetting some parties like the judiciary. The judiciary are so corrupt more than any other person in this nation. It's the end of the corruption, because if, for example, now EFCC arrests a politician who lost money.
You cannot just conclude that the judiciary, everybody is corrupt. That is not totally right.
But it's the end of it. After the whole hour we had there at the end of the day. So we have to look onto the judiciary too, because I have an experience of that. Because there is a clear cases like this, they will use money to turn it. Let the justice, if they can be making justice, the judiciary, if they can be making justice in this nation, it should have been helpful. That is my whole opinion, my whole what have you out of the corruption aspect of this nation. Thank you very much.
Thank you for your submission. The place of the judiciary in the fight against corruption.
And that brings us to
Adiba. We want you to respond to that.
Yeah, they have a very major role. The ball will actually stop at their decks if actually the right things were done. But before even going there, you understand, before we get there, there is machinery that's supposed to be in place for accountability, for transparency within organization, and then above each organization, you understand, to BPP. Have they utilized this platform? You understand? We have talked about policy. BPP is there. BPP is not the one that have actually put those figures in there. It's various organizations. They provided the platform for them to upload their information stage by stage. Therefore, the openness of that system is why we are deliberating now. They are also saying it, you understand? And then the acts have stated so many things, in this line. If there is a bridge, I think there should be a machinery you understand, behind that they are, that is actually in process right now. I cannot believe that they just see those reports from those organizations and they kept quiet. I cannot believe that. Do you understand? Now is the position of civil society is very critical in this kind of situation. Civil society.
What of citizens?
Also citizens, that is why people are calling in, you understand, to air their own view, you understand. And then if you don't provide this information to the citizen, they might not be able to to air their own view. Therefore, it's a kind of a circle thing, you understand. Everybody have to push his or her hand on deck to make sure that we fix out the corrupt people, you understand. Once we start showing a kind of using some people as a scapegoat, you understand, to others, that is where you can now start seeing integrity people in place. Sometimes you have people that are not corrupt. They are very mindful of their activities in civil environment, that is in public sector. You also have some company that want to do the right thing, but when there is no match, you understand.
In 30 seconds.
Yes.
In 30 seconds. What would be your advice to the President Muhammadu Buhari-led administration on bringing good governance to bear in Nigeria?
Monitoring. There should be a monitoring tools. We should not just talk, release money, do things, and there is no any monitoring. It's not by just coming to media and say this is the figure from Osun State, this is the figure from Kogi State. You understand? They should also tell us the figures, in quote, the money that has been spent and what they have seen. These are things that we are supposed to have a check. You understand? Those check is what I do say that if I have that position, I should give a platform where these ministers give their report almost every week.
Thank you so much. Amos.
Yeah.
30 seconds. Last take from you.
It's basically simple. Match words with actions. Hold people responsible for crimes committed, and don't cash out of the misfortune of people, because that's what these agencies have done, cashing out of taking advantage of the COVID-19 pandemic to actually exploit the people. Thank
you so much. Our time is almost up.
Yeah. Please visit the news page of our website, news.primark.org. That is news.primark.org. For all the details of our reports and interviews, visit our website, primark.org, to get all the information about Primark.
We sincerely appreciate our guest, Amos Abba from ICIR, and Diba Raji, who doubles as the Managing Partner, Global IT Africa Limited, and convener of Stay Away Corruption Campaign. Thank you so much for being a part of this.
Thank you so much.
We also appreciate those who called in, those who sent in messages via our number, and those watching us on Facebook, especially the ED, Agbon Suremi Okiria. We appreciate all of you. We appreciate Ricky Aheze. Thank you so much. Public Conscience is supported by the John T. and Catherine V. MacArthur Foundation, committed to building a more just, verdant, and peaceful world. Get more information about the foundation at its website, macfound.org.
Do well to join us again here next week for another interesting episode of Public Conscience. And remember to follow us on our social media platforms at Official Primark. We're on Twitter, Facebook, and Instagram at Official Primark. I am Chidozie Ubunaya.
I want to also appreciate the Primark team. Thank you so much. Public Conscience will be back next week. I am Adaobi Obiabumo. Stay safe.